Welcome to the Deep Dive. Ready to explore some seriously cool stuff? Today we're diving deep into artificial intelligence,
AI.
specifically how it's impacting two huge fields, healthcare and scientific research.
Right. It's everywhere these days.
We've got a whole stack of articles here that paint a pretty wild picture.
And it's not just hype either. We're way past the what if stage. AI is already making real changes, like how we diagnose diseases,
Develop treatments.
even how we do the research itself. It's mind-blowing.
It really is. It's almost like AI is this miracle worker in medicine all of a sudden. Earlier disease detection, personalized treatments, better use of resources, and even remote care, like telemedicine.
Yeah, AI is really good at analyzing huge amounts of data, I think. Medical images, genetics, patient records. It can see patterns and all that humans would likely miss.
And that's what's driving these advancements we're seeing.
Exactly. Diagnosis, treatments, even how healthcare is delivered.
Okay, so less talk, more action.
Yeah.
The articles mention some crazy specific examples, like AI reading mammograms way faster and more accurate than humans.
Yeah. Oh, absolutely. They're using what are called deep learning convolutional neural networks. Basically, these AI systems are trained on tons and tons of mammogram images. They learn to see super subtle patterns that indicate cancer.
They learn what to look for.
Exactly. And what's amazing is they can analyze images 30 times faster than humans, and get this, they can hit a 99% accuracy rate.
99%. That's got to be saving so many lives through early detection.
That's the hope.
Okay, so besides cancer detection, any other examples of how AI is being used for this personalized care everyone's talking about?
Definitely. There's this European project, the Maestria project. They're using AI to predict and even prevent heart rhythm disorders and strokes.
Whoa.
By looking at a patient's individual data, the AI can figure out who's at high risk. And then they can help doctors develop a personalized plan to intervene before something serious happens. Pretty amazing, right?
It's like having a super smart medical assistant, but it's working 24/7 and never takes a break.
Huh. Yeah, that's a good way to put it. It's not about replacing doctors, though. It's more like giving them superpowers.
Giving them a helping hand.
Right. Augmenting their capabilities.
Yeah.
But human oversight is still super important. Doctors are still the ones interpreting the AI's findings, making the final decisions about treatment, and, thinking about all the ethical stuff, too.
Making sure it's being used responsibly.
Right, exactly. So it's a partnership.
AI and doctors working together.
Exactly. AI analyzes the data, gives insights, but it's the human healthcare professionals who use that knowledge with, compassion and understanding to make sure the patient is okay.
It's a team effort.
It has to be.
Okay, so this is already pretty mind-blowing, but the articles went even further. They started hinting at something even more astonishing. AI actually conducting scientific research independently.
Like an AI scientist?
Wait, really? So this AI can come up with its own research questions, design experiments, analyze results, all on its own?
It can, yeah. It can sift through massive data sets, find potential areas of research, design experiments to test those ideas, and even write up reports based on what it finds. And get this, it could cost as little as $15 to produce a research article.
$15? Seriously?
Yeah. Traditional research can cost thousands, sometimes even millions of dollars. This could make scientific discovery accessible to way more people.
To smaller institutions, maybe even researchers in developing countries.
Exactly. It could democratize research, let more people get involved in cutting-edge stuff without breaking the bank.
That's incredible. But hold on. If an AI can do all this, what happens to human scientists? Do we even need them anymore?
That's the big question, isn't it? The way I see it, it's not about replacing humans. It's more about freeing them up.
Freeing them up from what?
From all the boring stuff, like data entry, all the tedious analysis. They can focus on the big picture instead.
Coming up with new questions, designing new experiments.
Exactly. Thinking creatively, solving problems in new ways, really pushing the boundaries of science.
So it's not replacing scientists, it's changing the nature of their work.
Exactly. Think of it like a collaboration. AI handles the grunt work. Humans focus on the high-level stuff, working together.
A dynamic duo.
I like that.
But as amazing as this AI scientist sounds, I gotta admit, it's a little unsettling too. The articles mention some concerns. What are people worried about?
Well, for one thing, how do you validate what an AI comes up with? Can we really trust its findings 100%, or do we need new ways to peer review its work?
Because the scientific process is all about checking and double-checking.
Right. And what about all those AI-generated research papers flooding scientific journals? Could they drown out the work being done by human
It's
scientists?
like a fire hose of information.
It is. So we need to figure out how to integrate AI-generated research into the current system without devaluing the work of human scientists or, overloading the whole system.
That makes sense. So while the potential is huge there are definitely big questions to think about as this technology keeps evolving.
Absolutely. Like any powerful tool, we need to be careful, think things through, make sure we're using AI responsibly and ethically in science.
Well, this has given us a lot to think about, from AI helping detect cancer to the rise of the AI scientist. It's clear that AI is already shaking things up in healthcare and research in big ways.
And we're just getting started.
I know. And on that note, I think it's time to move on to part 2 of our discussion. We'll be exploring the connection between these two seemingly separate areas, AI as a medical tool and AI as a researcher. Stay tuned, it's about to get even more interesting. Welcome back to the deep dive.
So we've talked about how AI is revolutionizing healthcare,
Mhm.
from diagnosing diseases to personalizing treatments.
And we even touched on that mind-blowing idea of an AI scientist doing research all on its own.
Yeah. It makes you wonder, how are these two things even connected? AI in medicine and AI as a researcher.
Right. Well, they're more connected than you might think. They actually feed into each other, creating this loop of rapid advancement. AI-driven research could lead to even more powerful AI tools for healthcare. Okay, now I'm really intrigued. Tell me more. How would that even work?
Imagine this. An AI scientist, it's sifting through mountains of data, genetic info, clinical trial results, scientific papers, all that stuff. And it finds a new drug target for a disease that was, like, untreatable before.
That would be huge But how does that actually help patients?
Well, that's where the loop comes in. That new drug target, discovered by the AI, it could be used to develop brand new treatments, potentially saving tons of lives.
I see. So the AI makes the breakthrough, and then other AI tools use that knowledge to help doctors.
Exactly. And it's not just about new drugs. AI can also change how we diagnose and treat existing conditions. Think personalized medicine.
Personalized medicine.
Yeah, we're talking about a future where an AI could analyze your individual genetic profile, your medical history or lifestyle, all of it, and create a treatment plan just for you.
No more one-size-fits-all medicine.
Exactly. It's all about finding what works best for you. And what's really exciting is this feedback loop, it keeps going. The more we use AI in healthcare, the more data it generates. And that data is used to train and improve the AI research, leading to even better tools and treatments.
So it's a win-win. Better healthcare leads to better research, which leads to even better healthcare.
It's like a snowball effect, and it's
Okay.
picking up speed.
Sounds like we're on the verge of a golden age of healthcare thanks to AI. But what about the scientists? If AI is doing the research, what happens to them?
Well, that's something a lot of people are wondering about. Do they become obsolete? I don't think so, but their roles will definitely change. AI can handle the heavy lifting.
The data crunching, all
Yeah,
that
right.
stuff.
But humans, we bring something else to the table. Creativity, critical thinking, intuition. You can't program that.
So it's about changing AW scientists' work,
Yeah.
not getting rid of them altogether.
Exactly. Instead of spending hours and hours analyzing data, they can focus on the bigger questions. Design new experiments, interpret what the AI finds. It's a partnership, really.
Like a team.
Yeah, each side playing to its strength.
This partnership between AI and humans, it could be really powerful. But I do have one concern. If an AI can generate all these research papers for just $15, wouldn't that just overwhelm everyone?
That's a valid point. We need to think carefully about how to manage all that AI-generated research, make sure it fits into the existing system without, causing chaos.
Maybe we need new ways to peer review research. Maybe even AI-assisted peer review.
That's an interesting idea. We definitely need to find solutions as this technology keeps developing.
So, lots of exciting possibilities, but also some challenges to think about.
That's always the case with new technology, right?
True enough, it's uncharted territory. But the potential is huge. And a little bit scary, if I'm honest.
I agree. It's a time of incredible opportunity. But we have to be responsible, make sure AI benefits everyone, not just a select few.
Well said. This conversation has really got me thinking. We've seen how AI is impacting both healthcare and research, and the possibilities are truly mind-blowing. But before we get too carried away, I think we need to step back and look at the bigger picture. What does the rise of AI really mean for the future? What role will humans play in this new world? Stick with us as we explore these crucial questions in the final part of the deep dive. Welcome back to the deep dive.
Whew.
My head is spinning after all that.
I know, right? AI analyzing mammograms, AI scientists writing research papers. It's a lot to take in.
It really is. It feels like we're on the edge of something huge.
Oh, definitely. A real turning point.
Before we go any further, though, I think we need to zoom out a bit.
Huh.
Look at the big picture. What does all this AI stuff really mean for the future of healthcare and scientific discovery? And maybe even more importantly, where do we fit into this AI-driven world?
You're asking the tough questions now.
Somebody has to.
Well, it's hard to say for sure what the future holds, but if we look at the trends we've been talking about, it seems like AI is going to play a bigger and bigger role in both fields. We could be talking about a future where diagnosis is faster, more accurate, and way more personalized, diseases detected super early, treatments tailored to your specific genes. It's pretty exciting stuff.
It does sound like something out of a sci-fi movie. But is it actually realistic? Or are we getting ahead of ourselves?
I think it's definitely possible, but we have to be smart about it. We need to make sure AI is developed responsibly, ethically, you know, always with humans in the loop.
So it's not just about the tech itself, it's about how we use it, the rules we put in place.
Exactly. Technology can be amazing, but it can also be misused. It's up to us to make sure it's used for good.
To help people, not hurt them.
Exactly. And that brings us back to the role of humans in all of this. A lot of people worry that as AI gets smarter, humans will become less important.
That will be replaced.
Right. But I think it's actually the opposite. We need to start thinking about AI as a partner, a collaborator.
Not a replacement.
Right. Doctors, scientists, researchers, they all have a crucial role to play, even in a world with super smart AI. Working together is how we'll make the biggest breakthroughs.
Earlier, we talked about AI augmenting human capabilities in healthcare. Sounds like that idea applies to everything we've been talking about.
It totally does. Think of AI as a tool, a really powerful tool. It can analyze huge amounts of data, see patterns we might miss, automate tasks so we have more time to focus on other stuff.
So we can focus on the big picture thinking.
Exactly. But AI still lacks some things that are essential for making decisions that affect people's lives. Things like empathy, ethical judgment, common sense. These are all things that humans are really good at.
So instead of being afraid of AI, we should be thinking about how to team up with it.
That's the idea. Recognize its strengths and its limitations. Work together to create something amazing.
It's a powerful partnership if we can get it right.
It really is. It could be the start of a whole new era of scientific discovery and healthcare innovation.
Well, this has been a truly fascinating discussion. We've explored so much, from the nitty-gritty of AI and healthcare to the mind-bending concept of an AI scientist.
It's been a wild ride.
It has, and it leaves me wondering, what skills will be most important in this future we've been talking about? What should we be learning, practicing, to prepare ourselves for a world where AI is everywhere?
That's a really good question. In an AI-driven world, things like critical thinking, creativity, emotional intelligence, those will become even more valuable. Those are uniquely human skills that AI can't replicate, at least not yet.
It's a good reminder that even in the age of AI, what makes us human is still our greatest strength.
Absolutely. It's what will allow us to shape the future, guide how technology develops, and make sure it's used for good.
Well said. Thank you so much for joining us on this incredible journey into the world of AI. We hope it sparks your curiosity and given you lots to think about.
It's been my pleasure.
And don't forget, you can subscribe to The Deep Dive on YouTube, Spotify, and even Amazon to catch all our future episodes. And if you enjoyed this exploration of AI, be sure to hit that like button and share it with your friends. Until next time, keep diving deep.